Hello, good afternoon, everybody. My name is Manish Prasad, and welcome to this series of Thoughtspace. This is focused on supply chain planning, the issues, impact, and solutions. This is a series of Thoughtspace where we will be talking about various aspects of supply chain planning and in various sectors. So today's topic will be more focused on the pharmaceutical and medical device industry. So today we have our guest and expert, Mr. Emre Safgonul. He is from Edexta Inc. He is Vice President and MD of European and Asian operations, Middle East and Asia operations, and he has 20 plus years of experience in supply chain field with Edexta. He has handled the consulting assignments. He has done the project management and the sales development, business development areas. So we will try to get things out from his rich experience of being in various sectors, various geographies. He has worked in USA, in Europe, and in Africa. So various continents he has worked through. So we will try to pick up his brain and understand the complications of supply chain from him. So Emre, very welcome for this session, and thank you for accepting our invite for this.
Thank you for having me, Manish.
Yeah. So just to set the context, the topic is supply chain issues, impact, and solutions. Why are we talking about it? I think the world has been a VUCA, which is very, very volatile, uncertain, complex, and ambiguous. It was always there, but it is more increasingly becoming more and more with the COVID time, with the pandemic. The supply chain disruptions is a way of life now. So we have seen a lot of stories about supply chain disruptions, logistic disruptions like happened in Suez Canal earlier, and now the containers not being available, ships not available. So logistics delays are there, uncertainties in the demand, uncertainties in the supply. So all this is making more and more complex. Complexity increases with the number of customer channels, with the number of supplier channels, number of SKUs, you name anything, everything is more and more, and that creates a lot of uncertainties in the demand and hence uncertainties in your supply planning. To my audience, I'll just like to tell them that in our blogs at cognosconsulting.com, if you refer to the blogs which we have written, so we have talked about the processes of supply and sales and operations planning and sales and operations execution processes, how they have to come together and create a magic, and why you require a digital twin kind of a model, more accurate model to do the supply chain planning so that you can actually co-join the planning and execution together. And we have also talked about that why the traditional way of spreadsheet planning or ERP-based planning will be very, very inadequate in today's complex world. So I'll not eat up more time on that, and I will ask Emre to share his opening remarks on the topic, and then we can get more into the pharma industry with him. Emre.
Right. Well, thanks for the intro, Manish. And I think we are all, especially these days, everybody is watching supply chain on the headlines. The White House making briefings about the supply chain, how things are handled, and so it's a great space to be right now as supply chain planning, practitioners. Basically, as we have the world's focus on us to deliver, right? And a lot of the focus right now is in the short term, and you already mentioned, and we'll talk about them, these disruptions from the containers to the very high publicized topic about the semiconductor shortage and so on. But there's also other aspects that are specific to the pharma around the regulatory piece that we will come and try to cover later on too.
Okay. So as I was talking about the complexities, so I understand from your deep experience that pharmaceutical industries or the medical device industry will have much more complications because there will be a lot of country-specific regulatory requirements, or the shelf life requirements will be there. So I wanted to elaborate on that. What kind of a challenges you see in the pharma industry over and above from the general industry where we do the supply chain planning? And I'm sure that whatever we do it in pharmaceutical will be also applicable to the general industry with different degrees on that.
Right. So there are couple areas that is shared across industries, but I think the number one that is very specific to or much more complicated and specific for pharma and medical devices industries is these country specific regulatory requirements, and this is not necessarily just by by a specific area within the supply chain. This is at all different levels of their supply chain. So it can be in the filling area of the supply chain, the site that needs to be regulated or certified to be able to serve a certain country, or the packaging area needs to be, or a certain API can come only, these active ingredients for the pharma industry can come only from certain certified suppliers to be able to serve the market. I think that's a very key challenge, and these regulations are to the point, I would say, which makes it interesting, is actually, even though we are talking about the same product from bill of material, all the ingredients, all the material, it's literally the same product. The country specific regulations can impose additional testing. So you are, in a way, you are producing the same product, but just to be able to serve in a specific country, you need to have more in-depth quality testing that you need to have as part of your process. So this is how we deal with these challenges. I seen with our customers as well, is these are for us, if you look at it, these are different attributes to the product, to the order, to the customer order that we are receiving, that we are propagating within the supply chain to a complex supply chain, a complex internal and external supply chain, to meet that demand. And that doesn't mean you need to have a specific different product definition, because it's, at the end of the day, it's the same product. Just use that attribute, for example, the country specific regulation, to model the behavior of your supply chain, rather than creating a separate product definition or a separate routing definition, etc. It's just how we solve this kind of problems is basically a best way we solve this problem is basically to use these attributes that are existing in this supply chain, like I mentioned, supplier qualification, the packaging site qualifications, to really model the behavior of your and replicate the behavior of your supply chain, to accurately create a plan, basically, without creating a complication.
So that means the complication is not so much in the demand sensing, but more in the supply planning. Will that be a correct statement?
I think it is more unique, I would say. I mean, the problem or the forecasting is applicable to any industry. I think that's and demand sensing, especially as you look at the products, over the counter type of products that are seasonal products. All these, now is the flu season coming. The cold, we're gonna catch all of us are gonna probably start catching a cold, and etc. So definitely there is that aspect is there, but it's one of those that is shared with other industries like CPG as well, right? You have these seasonal products, but the uniqueness in our experience comes more around the supply supply chain planning side, than the demand side.
And you had mentioned that the product may not be that much different, but the testing requirements and hence the accompanying compliance reports and the packaging, the prints on the packaging, they will make more complicated supply chain for you.
Right. And another area, for example, again, when we talk about pharma or medical devices, people all think about this big pharma. There's a chemical process, there's a magic that happens that creates an active ingredient and puts into tablets that you buy. And there's more to it in terms of, especially as you go into topics like biopharma, where the manufacturing process is more of a cell base that is like closer to farming, as you're growing these step by step these cells, and they need to go to processes to in a certain period of time, because otherwise they will expire. So uh, so uh, the the typical shelf life type of constraints or problems that you have also in, again, on food and beverage type of industries and or others is can be more complicated or more interesting in a way as you go into a biopharma, for example. It's not just that you need to keep you need to look at the remaining time of the product that you, when you sell to a certain country, because that's also another area for pharma. Certain countries only will allow products with certain remaining lifetime on it, or shelf life on it. Whereas in biopharma, even within the manufacturing processes, you have the shelf life, or not the shelf life type of requirements between the stages of production, so that if you can't make it to the next stage because there's a bottleneck and you are waiting, your whole batch could expire and you can't use it. You may lose it. So these are, again, for us, attributes that you can use to model the behavior of your supply chain or manufacturing operations to really accurately have your digital twin or digital mirror of your operations.
So the shelf life requirement, how this will be different or similar to the consumer product industry, or say specifically the food industry. So their requirement is also there on the shelf life. So pharma, will it be very, very different from that or very similar behavior?
Right. It is similar for the finished good, right? So that piece is I think it's very similar, or very similar in terms of okay, once you've packed the product or looked at all the ingredients coming into the product and packaged it, what's the remaining shelf life of that product you sell? I think that is it's a good overlap there. The big difference comes, um, I would say, as I mentioned, in more on the biopharma side, or where within the manufacturing steps, which could be in biopharma multiple. I would say in CPG is much shorter. It's only it's typically you make something and then you fill it. In food and beverage, here you're looking on a longer process of growing these cells, and every stage has its own shelf life to complete before you can move. You have to move to the next stage.
Oh, so you mean to say that even the WIP product will also have a shelf life issue, not just the finished good?
Exactly.
Yeah. So that makes it very complicated, and that brings up another question, because most of the pharmaceutical industry also engages in the contract manufacturing. So that makes it very, very complicated, because if you have got restrictions on the intermediary shelf life also, how do you
Right.
manage the contract manufacturing there?
Well, I mean, to be able to manage the contract manufacturers, you need to have that multi-enterprise planning capability. So you need to be able to model those different entities across your supply chain, not necessarily just your entities, but your subcontractors, these contract manufacturers, and you need to have the collaboration and the tools in place to work together with them, because it's typically very changing environment, and you don't have full control of them, or a changing degree of control over your subcontractors depending on your contracts with them. You may have certain capacity reservations, you may have high level, or you can have part of their plant dedicated to your products, so that you can really decide on the mix and have a high degree of control over it. Or you may be at a very high level, you just issue your PO and they deliver it to you, and you collaborate on those. So there is different degree of control you could have, and that brings more challenges. But and this is not too unique to pharmaceuticals. We see that, I mean, this is a common way of operating in the high tech industry, for example. There's that overlap. The pharma companies are moving more towards that contract manufacturer in terms of complementing their their own manufacturing operations as they grow, or moving towards more of an assetless or asset light strategy that brings more focus to these contract manufacturers. But the key is, do they have, I mean, having that solution to be able to collaborate with them, at different, depending on the planning horizon, different level of granularity, give them a good forecast of what they need to do. Have a honest dialogue with them in terms of what they can really deliver, so that you can keep the promises you have to your own customers, right? And be realistic in terms of your expectations, in terms of your measurements. Have your risk management in place with having multiple contract manufacturers in case you have difficulties. I mean, especially this is a topic that right now everybody's talking about, right? Diversifying the number of subcontractors, especially with the COVID, once China did shut down, or certain regions and countries shut down as they get affected by COVID. This became immediately visible in terms of boom, you lost your half of your production. So what do you do now? And that is affecting definitely pharma. The key words you will hear is collaboration, visibility, accurate representation of the capabilities of your contract manufacturers, and having often updates in terms of where things are, so that you can really manage it and still deliver. Find ways to keep to the promises that you made to your own customers. Because at the end of the day, what we are all looking is like, what's our promise to our customers, right? That's what we are measured. If you look, I mean, we can talk about a lot of KPIs that in terms of inventories or etc. But the key, I think, the top one everybody is watching in this competitive market is the customer delivery performance, right? So we want to ensure we have the right supply chain in place, enabling us to meet our promises to our customers.
So this also brings up a topic of demand sensing versus the normal forecasting. So
Right.
how do you propose that people should modify their demand planning so that they get more accurate forecast or better demand sensing? So do you have something to offer to them?
Right. I think in terms of when you look at demand forecasting and demand sensing, I think it depends a little bit on the maturity of the company, right? There is when we work with our customers or prospects, we pick them up at different levels maturity levels in terms of the organization, in terms of the processes they follow, and as well as industry requirements. So I would say in terms of the forecasting, the way we approach and we recommend our customers also approaches, typically they have quite a lot of products, a variety of customers, that they're selling into, and to a certain point they manage to do that with their Excels and some point solutions, etc., until they can't, until they see the accuracies suffer, and that creates this whole inventory buildups, etc. So where we help and what worked in the past well is to guide our customers. Okay, you have a good input from your own customers, your commercial teams. There's a good amount of feedback or bases you can create from actually statistical forecasting supported by machine learning that covers the parts of your portfolio, not necessarily, especially for bigger customers or bigger customers with a big product portfolio, let's say, across high number of customers. The key is segmenting, and we use a little bit of a visual term called animal farm in terms of focusing on what matters most. So we call maybe create a matrix of across value, volume versus predictability, and identify high value, less predictable parts and or products and customers. That's where the focus should be in terms of the discussions between the organization, the commercials, and the even finance, central planning, versus the other ones could be, to a certain degree of level of degree, can be covered with more automated statistical forecasting supported or solution supported techniques. So that will be our recommended way of looking at it. And as you go into industries like pharma, more towards consumer facing side, or the CPG, then you're also going into more granular level of planning, down to day level planning, and that's where really the demand sensing comes into the picture. I mean, we have also customers in the CPG. We talk about beverage, weather, and beverage is a good example that everybody likes to talk about. I mean, you can use the same topic with the pharma as well, cold weather and cold medicine picking up, and that is definitely an aspect, and we use in our solution as well. The key is it's more relevant and useful when you're looking in the short term, like in the next 4 or 5 days, 3 to 5 days type of horizon. So not necessarily maybe when you're doing your yearly plan. I mean, there you that weather component is not so. I hear all these different topics or external factors that can affect the forecast, and we talk about them, and some of them are relevant. I think the key is like, what is relevant for your industry that really makes an effect, and we work with our customers in terms of to analyze their data to see which of those are really relevant. Is the weather really a component, or some other external factor or internal factor that is relevant to the accuracy of their forecast?
I'm sure, this is very exciting, the demand planning itself. So probably we can dedicate one full session only to understand the complexities in the demand planning. But right now on the pharmaceutical, I think I'll have one more question to you. Factory planning, the shop floor planning, how it is different and more complicated than the others? Like, typically, how do you do the sequencing of product or the setup optimization? Are those same challenges there with in the pharmaceutical, and you have to deal with that? And what is the impact of that?
Right. I think key thing you will see in the pharmaceutical is these long campaigns, especially in the chemical side of it, and lining up those, which involves a lot of quite a big setup times because of the cleaning and other perspectives. So that's a definitely key challenge. But we see also room for improvement, and this is an interesting thing. As we go into a lot of these prospects and companies, we realize a lot of them still, plan these operations in the manufacturing side in Excel, or in their ERP solutions without really with following some rules of thumb. I mean, they know their operations, obviously, right? So, but not necessarily fully optimizing or taking full advantage of optimizing their setup times, or synchronizing the different parts of their planning. For example, the compound tanks, when one of our customers at Elegant, in terms of the compound fans as tanks, as well as the filling lines, to be to get the most throughput and the most utilization of their equipment, in terms of because at a high level, and this is also interesting, at a high level, when they make their S&OP plan, right, they don't have typically the granularity. So they're when they hand over these plans, especially for companies that they do that high level S&OP plan and hand over these plans to their plants or manufacturing sites, they come or with a surprise, because the plants can't do it because it's not realistically modeled, etc., or it's not accurate. So we help the companies really to by modeling these details of their capacities and the constraints of the setups or other these synchronization between different areas within their operations to really create the executable plan that the planners can really work with.
So for making the executable plan, how does the Edexa work? Like, does it follow a lean, agile, or TOC, or some of those execution theories, or you have something of your own?
Uh, Definitely, in terms of the, I mean, we follow definitely topics like the theory of constraints, especially as you go into the sequencing level, identifying the bottlenecks, maybe focusing on the buffers or queues in front of the bottlenecks, and then planning the rest of the equipment. So there are definitely overlaps, and I would say it's more complementary than competing solutions, as we do use a number of these well-known topics within our solution as well. The I would say the difference or is more on the completeness in terms of covering the whole operation or the whole supply chain, and being able to really follow the whole connections across the supply chain or the operations.
So that means a company which is already following, say, a theory of constraints or the lean type of processes, they will find adopting your digital solutions much easier because they are compliant to that kind of working.
Absolutely, they will, and they will see, that we are identifying easily the changing bottlenecks. I think that's in their operations, based on the mix, these bottlenecks are moving around, right? So finding that, making sure those are addressed and moved. It's a demand-driven solution. So if there is no demand, then there's this pull. We follow that demand pull mainly. So they will definitely find themselves at home when they look at the Alexa solution.
Okay. Thank you for sharing all that, Emre. And I think the time is very, very short for continuing on this topic. I'm sure, and I will request my audience that, you can send your questions in the chat box to us. You can send your suggestions directly writing to us on our LinkedIn page, or, you can, send a message to us across. And in our series of conversation in future, we will try to cover up the topics of your interest. And stay tuned. We will keep talking about the supply chain issues, impact, and solutions. Today, we have just scratched the surface. And
Right.
pharmaceutical industry is something which is just a very, very overview, I'm sure, Emre, and you have got a lot to share your experience. Probably we can pick up a case study in future and go into more detail. But for now, I think that is all. So thank you very much, Emre, and request you any parting advice to the audience if you want to give on the supply chain planning, please.
As I said at the beginning, it's a very exciting space to be right now. I see that within my conversations with different companies. So happy to be here today. Thank you for the opportunity. And yeah, let us catch up if there are any questions or follow-ups.
Thank you very much, Emre, and goodbye, everybody. And all this video will be posted on the LinkedIn page, our YouTube channel, as well as on our websites will be available if you want to refer to it. Stay in touch, stay tuned. Thank you very much. Goodbye, good evening.